Right, I'm going to start out by having the patient walk into the room and take a seat. How are you doing today?
Doing well, thank you.
Good. So I'm going to start with my general survey. This is where you would take any vital signs, weight, height, and you would also generally evaluate the patient. He seems to be at ease. He was able to walk in, take a seat on the chair without issue. He looks not distressed. He has an upright posture. There's no swaying side to side. He had an appropriate response to my questions. Mental status would also be evaluated at this time, more so with the subjective data collection, which we will defer for the moment. So moving on to the head, ears, eyes, nose, and throat. I'm going to start by inspecting the head and the neck. I'm looking at the skin. I'm looking for any deformities in terms of the neck. I'm looking for any masses and making sure that trachea is midline. And then I'm going to palpate the scalp, feeling for any deformities in the scalp. I'm also noting the hair, its pattern, and its texture. At this time, I'm also going to palpate the lymph nodes, the post-auricular, the pre-auricular, the occipital, the submandibular, the submental, and then the supraclavicular lymph nodes, feeling for any inflammation, any enlargement, any tenderness upon palpation, which there is none at this time. At this point, I am also going to palpate the thyroid. I'm going to have the patient swallow for me, feeling the size of the thyroid, feeling the texture, making sure there's no irregular nodules, which there isn't at this time either. And then I'm going to move on to palpating the carotid arteries one at a time, feeling for that 2+ pulse with a regular rate. And then you can also auscultate the carotid arteries at this time with both the diaphragm and the bell of your stethoscope. Next, what I'm going to have the patient do is a range of motion of the neck. So I'm going to have you put your chin to your chest. Go ahead and lift your neck up and then move it side to side and make sure there's no tenderness or limited range of motion during those tests. Testing for cranial nerves in this area. Cranial nerve 5 is the light touch. So I'm going to have you close your eyes and tell me where you feel me touching you.
Forehead.
Good.
Chin.
Good. I'm also going to have you clench your jaw for me. And I'm going to palpate that masseter muscle, making sure it's strong with an equal. Good. And then I cranial nerve 7 controls the facial features. So I'm going to have you smile for me and show me your teeth. Good. Raise your eyebrows. Awesome. Puff out your cheeks. Good. And then squint your eyes closed and try to hold them closed. Good. And then cranial nerve 11 has to do with the neck and shoulder muscles. So I'm going to have you shrug your shoulders against my hands. Good. And then turn your head against my hand, side to side. Good. Good. All within normal limits at this time. So moving on to the eyes, I'm going to start by inspecting the external eyes. I'm looking at the sclera, making sure the conjunctiva is clear. I'm looking for any ptosis, any eyelid drooping, any eyelid twitching. Seeing none. I'm going to move on to assessing cranial nerves 3, 4, and 6, which tests for extraocular motion and accommodation. So I'm going to have the patient follow my finger with just your eyes, okay? Good, good. No abnormalities there. Next, I would test for pupillary response, which has to do with the second cranial nerve. I would turn down the lights and I would flash light into each pupil, making sure there's an appropriate constriction and reactiveness of the pupil in with the light. Next, I'm going to move on to the fundoscopic exam. So I'm going to look for the red reflex. And then look at the disc margin, making sure it's nice and brisk, making sure there's no papilledema, and making sure there's no cotton wool bodies in the area, which could be indicative of conditions like diabetes. And you would do the same on the other eye. You could also test for visual acuity at this time. However, I will defer that for the moment. Next, inspecting the ears. You're going to inspect the external ear, making sure there's no deformities, irregularities, and then use your otoscope to inspect the internal ear. You're looking, pulling up and back. You're looking at the internal canal, making sure it's skin colored. And then you're also looking at the tympanic membrane, making sure it's pearly, white, and non-bulging, which is all normal findings. And then moving on to cranial nerve 8, which tests for hearing. I'm going to have you close your eyes and tell me which side you hear noise.
Right. Both.
Good. If you were concerned at all about hearing, you can move on to the Renee and Weber hearing tests, but given this was normal, I'm gonna move on to the nose. I'm gonna inspect the outside of the nose for symmetry. I'm gonna look at the skin on the nose. I'm gonna look at the shape of the nose, and then I'm gonna look inside the nose for patency. My otoscope here. Nice and patent. And then the last thing I'm gonna do with the nose is palpate the sinuses. Any pressure or tenderness here?
No,
Good. How about here?
no,
Good. And then lastly, I'm gonna inspect the mouth and the throat with my light. I can get it off. Perfect. So I'm gonna have the patient open their mouth. I'm gonna shine a light, and we're looking at the mucous membranes, making sure they're pink. We're looking at the uvula, making sure it's hanging midline, making sure the tonsils aren't inflamed or have exudate on them. And then the test for, and also looking at dentation, taking note of their teeth. And then I'm gonna have the patient lift their tongue. Good, looking underneath for any evidence of leukoplakia under the tongue or in the mouth, and then on top of the tongue, you can look for any evidence of thrush. And then to test for cranial nerves 9 and 10, I'm gonna have the patient say, aha. And I'm looking for the symmetric movement of that palate up, down when they say, aha. And then cranial nerve 12 controls the tongue movement, so I'm gonna have the patient stick their tongue out and move it side to side. But making sure there's no atrophy or difficulty moving that tongue. Right, so while the patient is sitting, you can inspect the back. You're again looking at the skin for any lesions that look abnormal, any masses. You're looking at the muscle tone and the height of the shoulders, making sure they're even. And then you can palpate down the spine, feeling for any deformities or any tenderness upon palpation. And then you can also check for CVA tenderness at this time. Any tenderness with that?
no,
Good. And then starting out, you can percuss the back of the lungs. This should be resonant throughout, giving your palpate or your percussing over lung fields. And then repeat after me, 99.
99,
And again,
99,
and that was testing for tactile fremitus, which was a normal vibration with the vocalization of the word 99. Next, you can auscultate the posterior lung sounds, feeling for one breath in each lung field. Good. And then lastly, while the patient is sitting, you can feel for their axillary lymph nodes on both sides. Lying supine, we can move on to respiratory, cardiac evaluation. So you're going to start again by inspecting the chest, looking at the skin, noting the rise and fall of the chest with breathing. You can palpate the PMI at the 5th intercostal space at the midclavicular line. Then you can move on to auscultating the heart sounds. You're listening for any murmurs, any abnormal heart tones. You're also taking note of the rate and the rhythm. In this case, normal S1 and S2 are heard. You can then move on to auscultating the lung sounds on the front. Again, listening for one breath in each area. You're noting any adventitious lung sounds. In this case, lungs are clear in all fields. And then you can move on to palpating the peripheral pulses, both radial and ulnar pulses, noting a +2 amplitude with a regular rate. Moving on to the GI-GU, again, starting with inspection, looking at the external abdomen, you're noting any hernias or any masses that you can see. You're looking at the symmetry, the contour, noting a midline umbilicus, and noting any peristaltic movement you can see externally. You will then auscultate all 4 quadrants, noting active bowel sounds in all 4 areas. You can then auscultate over the liver and the spleen for any friction rubs, which would be an abnormal finding. And then you can use the bell of your stethoscope to auscultate over the abdominal aorta, the renal arteries, the iliac arteries, and the femoral arteries, noting any bruits, which also would be an abnormal finding. Then you can start with light palpation in each 4 quadrants, feeling for any tenderness or resistance. And then deep palpation will be able to help identify any masses, as well as identify organs like the liver and the spleen, and potentially the abdominal aorta. And then At this time, you can also palpate the femoral pulses, again, feeling for the amplitude and the rate. So moving on to the musculoskeletal and sensory exam, I'm going to start with the arms and I'm inspecting the skin and the muscle tone. I'm then going to palpate the elbow, the wrist, and the hands, joints for any inflammation, tenderness, effusions, nodules, irregularities. I'm then going to test for range of motion. So now you put your arms up like this, and then down, and out and touch your shoulders. Good, I'm gonna have you supinate and pronate your hands. Good, open and close your fingers. Good, I'm then gonna test for strength, so I'm gonna have you put your arms out and push up against my hands. Good, and then I'm gonna do this. Hold up against my hands. Good, and then I'm gonna have you squeeze my fingers to test for hand strength. And then sensory. I'm gonna have you close your eyes and tell me where I'm touching you.
Right bicep. Left forearm.
Good. And then moving on to proprioception, I'm gonna have you keep your eyes closed and tell me if I'm moving your finger up or down.
Up.
Good.
Down.
Good, and you would do that again with the other side as well. To test for coordination, I'm gonna have you open your eyes and touch my finger and then touch your nose. And then I'm gonna have you close your eyes again and hold your arms straight out, testing for pronate or drift. Again, there is no pronate or drift, which is a normal finding. To test for deep tenon reflexes, if I had a reflex hammer, we would test for the brachioradialis reflex, the bicep reflex, and the tricep reflex. And then moving on to the legs, I'm gonna have you scoot forward to your feet are on the floor. We're gonna again inspect the legs, inspect the skin, inspect muscle tone. I'm then gonna palpate each joint for any fogginess, any effusions, any tenderness, pain, inflammation. Perfect, and you would also palpate the other leg. And then I'm gonna have you push against my hands for strength. Good. And then push up against my hands on your feet. Good, and then push down against my hands. Good, and then to test range of motion of the ankles, I'm gonna have you point and flex your feet. Good, and then move them in and out. Good, and then invert and evert your feet. So inside and outside. Good, and then point and flex your toes. Good, and then deep tenon reflexes in the legs would be the patellar reflex, the Achilles reflex, and then the Vinci reflex is the bottom of the foot, and the toes should go downward in adults. And then moving on to standing, we're gonna test range of motion of the legs. So I'm gonna have you actually turn this way and bend your knee back and kick your leg forward. Good, on both legs. Good, and then I'm gonna have you bend forward, testing range of motion of the spine. Again, while he's doing this, I'm looking at the alignment, making sure there's no evidence of scoliosis. And I can have you stand back up and bend your spine backwards a little bit, making sure there's no tenderness in this range of motion test of this spine. Perfect. And then to test for balance, I'm gonna have you toe heel walk. Good, and then you can come back. Another balance test you can do is called the Romberg's test, where the patient will stand with their arms at their side, first with their eyes open, and then with their eyes closed, assessing for any swing or any evidence of imbalance.